Hi, my name is Dr. Jon Repole with Jacksonville Health and Wellness Center, and today we're talking about our anti-inflammatory diet. So why inflammation? Why an anti-inflammatory diet? Pretty simple. Scientific community, consensus, inflammation is linked to diabetes, heart disease, cancer, and many more diseases. From a musculoskeletal standpoint, neck pain, lower back pain, headache, knee pain, ankle pain, inflammation is pain. You decrease the inflammatory load, you decrease the pain levels. So let's use an analogy. Let's imagine inflammation to be fire, and imagine your body as a house on fire. You can choose to add foods that act like water, which decrease that inflammation load, or you can choose foods that act like oil, which increase that inflammatory load in the body. So now, you simply want to avoid the foods that act like oil and increase the foods that act like water. So we're going to go from general to more specific. In general, animal products and processed foods are pro-inflammatory, meaning that they increase inflammation in the body. Whole plant-based foods are anti-inflammatory, meaning they decrease inflammation in the body. And notice I said the word whole, because we're not talking about processed vegetarian foods like soy hot dogs and hamburgers and Twinkies and those types of foods. We're talking about foods in their original state. How much of a difference does this make? Well, science is pretty clear on this as well. Switching to a whole plant-based meal as compared to the standard American diet, say a hamburger and French fries, you're going to be getting 1 billion to 1 million-fold decrease in the physiological inflammatory load on the body, which is a huge response. So think of that day in and day out, that you're taking that much inflammatory load off of the body. All right, so we've kind of got the general picture. Now let's go into the specifics of a whole food plant-based diet. Regardless if a food is healthy, if you are allergic to it or sensitive to it, it's going to increase the inflammatory load by the body. So we want to pay attention to any foods that you have deemed to be sensitive to or allergic to and take those out. Gluten is a protein which is found in wheat, rye, and barley. And it's problematic in the sense that it's been linked to a host of issues, from neurological disorders to GI disturbances to fatigue to hormonal disturbances and, of course, inflammation. So we challenge our patients initially, just take the gluten out and see what happens and monitor yourself. So it's not as hard as you think to recognize the gluten-containing products, because no one really cooks wheat, no one really cooks rye or barley. So most of, if not all, of your gluten-containing foods are just processed food. So again, we're wanting to make the switch away from animal products and, say, processed foods to more plant-based materials. Okay, getting more specific. There are certain categories of foods. One of them in particular is called the Nightshade family, which is tomatoes, potatoes, eggplants, and peppers, that have some chemical components in them that increase or store the inflammatory load. Especially if you have an autoimmune condition or RA, you want to be really be careful and watch out for this particular family. So recommendation could be take it out for a week, see how your body does, slowly add each one back in and see and monitor if there's any type of inflammatory or any type of symptom that you might get, as maybe in the case of rheumatoid arthritis, your joints start swelling up after you eat a tomato, right? That would be a good correlation to notice that maybe that food is not particularly good for me. And it's individual. It doesn't mean a tomato is horrible, right? So then we move on. You know, there's so many foods now in the plant-based kingdom that all of them are anti-inflammatory. But when we look at fruit, as an example, there's bromelain, which is found in pineapple, which is anti-inflammatory. Papaya, the berry family, is extremely anti-inflammatory. There are certain herbs and spices like turmeric and ginger root that should be used on a regular basis to help decrease the inflammatory load as well. So here's your challenge. Breakfast, start with green smoothies. Look it up online. There's so many resources that are available. Pick 2 or 3 green smoothie recipes that you like and begin to make a commitment to have them every morning. Between breakfast and lunch, commit to snacking on, say, fruit. of your choice, whatever you like. And between lunch and dinner, commit to snacking on fresh vegetables like carrots or celery or cucumbers or so forth, or maybe a small handful of nuts and seeds. And then the last couple challenges here is take your lunch and take your dinner meals and start transforming them, or quote unquote healthifying them, into more of a whole plant-based meal. So maybe you start with lunch, and then you start with then maybe next dinner. And you just gradually begin to make that shift into decreasing the inflammatory load and challenging yourself to see how much can you go on a whole food plant-based diet. And don't take my word for it. Give it a try. Maybe do it for 2 weeks and notice your energy levels. How does your gastrointestinal system working? Take a peek at your skin. Is the dryness going away? Are you getting more moisture content in your skin? Pain levels decreasing, and so forth. And use that as a gauge. Let your experience guide you to see how you're feeling. And obviously, if what you're doing is helping you, then you're wanting to continue on this journey. And we are here at Jacksonville Health and Wellness Center to help you along this process further. If you want more specific individualized attention on meal planning or cleansing, we're here to help you. Thanks so much for listening to this short segment.